Welcome to Bodacious Estate Conversations, the podcast where we skip the polite small talk and get straight to the real story about handling a loved one's property. From unexpected challenges to the messy emotions nobody warns you about, I bring you unfiltered stories, practical advice, and clever shortcuts from people who've been there and the professionals who know the way. If you want honest answers, bold strategies, and the confidence to take control, you're in the right place. Here is your host, Kasey King.
Thanks for tuning in. On today's episode of Bodacious Estate Conversations, I'm excited to chat with someone who's helping hundreds of people confidently navigate one of life's most confusing systems, Medicare. Our guest has been licensed since 2018 and funded Medicare tutor in 2020, where she's built a thriving business now serving over 500 clients with personalized Medicare guidance. When she's not helping clients find the right plan, she's a proud mom who loves music, gaming, and making memories with family and friends. Let's give a warm welcome to Emily Henderson. I'm thrilled to have you on Bodacious Estate Conversations, Emily.
Hi, Kasey. Thank you for having me.
Oh, it's my pleasure. I'm so excited. So today we're diving into something that affects most every family at some point or another, and that's Medicare. So whether you're approaching 65 or helping a loved one make sense of their coverage, understanding your options can save you thousands and a lot of frustration. Stick around to the end because Emily is going to share the one mistake that could leave you paying a $615 drug deductible you didn't even know about. So Emily, let's just dig right into it. Medicare can be so confusing for a lot of people, especially when it's time to review and change plans. What's the biggest mistake you see people make when they first enroll or if they're helping a loved one through the process?
Yeah, I really think that a big mistake people make is they think that they can kind of do it on their own. It is very confusing. They send you that big, thick Medicare and You handbook. I've had so many people in my office this enrollment period coming in and saying this thing is so hard to get through, and I'm like, well, you don't need that. You have me for that. I can help you figure out, how to navigate the maze that is Medicare. So I really feel like people should be sitting down with someone and helping that professional help them decide. So hopefully they're putting in their medications, their doctors, and all of that to make sure that the plan that they're going to be in will suit them.
So it's open enrollment right now, right?
Yes.
It's the season. I imagine with it being open enrollment season, you're seeing a lot of this come through. So in order for someone to make sure that they're on the right plan that is most appropriate for their needs, what are some things that you would need to know about them?
Well, usually when they call to make the appointment, we'll get their list of medications, we'll get their list of doctors, we'll get their Medicare number, and that's usually it. If they can't locate their Medicare number for some reason, we might ask for their social security number so that we can look it up. But other than that, it's pretty simple. I mean, most people have a list of their doctors and meds handy, and just giving us that information would really be helpful so that we can make sure that everything's covered nicely for you.
Okay, that's not as in-depth as I thought it would be. I thought I'd have to come to you with, like, my whole background and family history. That's awesome. So, when somebody's signing up, like, what's the time commitment, when they're sitting with you?
Usually takes about an hour. Like when I'm meeting with initially when someone's first turning 65 or when they're first going on to Part B, which is the triggering factor because you can work past 65 and delay taking Part B if you want. So that's usually takes about an hour, that initial meeting. It can be done over the phone. It can be done in person here in my office. It can be done via Zoom. I really try to meet the people where they are and just help out in any way that we can.
Yeah, I love that. So when looking for the right plan, you said that you would want a list of their doctors. Are there plans like that would help? So let's say I wanted a doctor outside of like what does that look like? If I had a doctor, but now all of a sudden he's no longer in network. That's the term I was looking for, in network. Would I have to switch doctors?
No, I really strive to make sure that whatever doctors that you have that are non-negotiables that you must keep, that whichever plan we put you into is going to work for you. So the first thing I look for is like, are the medications covered? sufficiently affordably for you. Second thing I look for is are the doctors in network, the ones that they want to continue to see. So I don't need the doctor that did your knee surgery 10 years ago, if you're, just the ones that you're are non-negotiables really. But yeah, so if I get all that info, then the third is like, okay, now we're going to talk about the extra things that you can get within the plan. So start with the medications, affordable, then the doctors, and then the extra perks.
I love that. So what are some of the extra perks that could come in a plan?
Yeah, so if you chose, of course, when I sit down with someone initially and do like a Medicare one-on-one with them, I explain, one side, which is, getting a supplemental plan, the other side, which are advantage plans, which are very popular. I mean, I won't say popular, but there's a lot of commercials and a lot of like marketing geared towards these advantage plans. They oftentimes include the perks that might be like an over the counter benefit where you can go to the drugstore and get extra, things. They'll often include dental, vision, and hearing insurance. A lot of them include gym memberships, um, just to name a few perks. Some of them do it like a give back, well, they'll give you money back on your Part B every month. So there's just all variety of different perks that different plans will offer.
Yeah, I love the gym membership. So our local YMCA does like water tai chi and like chair yoga, and it's so important for folks to continue to move. I feel like that's one thing when folks retire, they're like, "Well, I've got nothing to do now." And, they just stop moving. When my mom retired, she asked all of her friends, like, "What do you do to stay busy?" And a lot of her friends told her, "We just watch TV all day." And she's like, "Oh, I'm not doing that."
Oh, yeah. And so many seniors use the Y as like a kind of a social, not to work out as well, but like as a social, like they go every day to the Y to meet their friends. So yeah, absolutely. Stay active.
So, what's like a common pitfall you would see with folks? I mean, obviously, it's hard to understand if you're trying to choose your own plan, which is why I would go to a professional like you. But what are things if they did choose their own plan and maybe chose inappropriately based off of the coverage they needed? Like, what are some of the things that you would see?
Well, mainly the pitfalls are that, they choose a plan on their own and then all of a sudden they say, well, gosh, my doctor doesn't accept that plan. And now I've got to either pay out of pocket to see that doctor or I've got to, choose a new doctor. And that's the main pitfall. And of course, if your medications aren't covered sufficiently and, the medication's not in the formulary, then, it's not subject to the $2,100 max out of pocket, So that's a really important thing to note as well. Make sure the drugs are in the formulary. If they're not, then you could end up paying who knows how much for those medications?
Yeah, medications aren't cheap, that's for sure.
No.
I once got total side note, but it just popped in my head. I got eye drops for allergies. So they weren't over the counter; it was prescription, and I had to pay when I got it like $100. It was a little over $100 for a teeny tiny vial of eye drops. And I asked the pharmacist when she told me what the total was. I was like, "Didn't my insurance cover it?" And she's like, "Oh yeah, that's after your insurance." Like, holy cow! How much are these eye drops? Like, it's crazy what they're charging for prescriptions.
I've seen that. I helped another couple a few years ago. They were actually in their 80s at that time, late 80s. I helped them out. And she was on a very expensive eye drop, $500 a month. They didn't know they had to have Part D. Again, they were in their late 80s. Very savvy though. The man, he was very capable of like checking his email and checking PDFs and sending me PDFs. And it was really cool. But they didn't know they had to have a drug plan. So they never needed one. They were healthy, but she was paying $500 a month for her eye drops, and I was able to help get them in a plan that covered it at $60 a month, so,
Yeah, that's a huge cost savings.
yeah, definitely.
So, all right. So, I think we understand the common pitfalls, why you'd want to work with a professional to help guide you through the necessities of it. So, when somebody comes to you for the first time to enroll, like what are the questions that they would typically have?
When they first come, I mean, they always wanna know, you know, typically, when they first come to me, I guess that's hard to say because I do a lot of the talking initially, and then as I'm doing my presentation, questions come up. A lot of the times people wanna know, will I get penalized if I don't take Part B right away, if I'm still working? That's a common question people will wonder about. And, the short answer, I guess, is that if you're delaying your Part B, if you're gonna work past 65, you can delay taking, really all parts of Medicare. You don't have to take either A or B. Um, but, uh, if you have active employment, if you have creditable coverage through active employment or through a spouse's active employment, then you can actually delay taking Part B until you're ready to retire. But oftentimes I advise people, if you're on the fence about when you might want to retire, it's a good idea to maybe sometimes take the healthcare out of that equation. So that way you can retire when you want and don't have to scramble to get healthcare. So there's all sorts of factors, and we're happy to, help people with, any of those questions. Some people don't know how to sign up for Medicare. I help them through that. And it's not just you come here and I talk at you and get you a plan. I really want to work with people and help them in any way that I can when it comes to Medicare. So,
That's what business is all about, having the relationships and helping people when they need it. So, just as a reference, what is the difference between plan A and plan B?
so there's Part A and there's Part B. Yeah. So that's the Part A and Part B are the two original parts of Medicare. So when Medicare was first, thought up, I should know that year. I don't really, but A and B were the first two parts that were, I guess, invented. And Part A is your hospital insurance. So Part A is premium free for most people who have worked and paid into the system over the years. So when you get your check stub and you see, Medicare taxes on there, that's gonna get you a premium free Part A when you're ready to take it. So, it makes sense for a lot of people to get Part A even if you're not gonna retire yet, and you wanna keep your work insurance. The only time it wouldn't make sense is if you're contributing to an HSA, you should probably not take Part A. But that's hospital insurance, and then Part B is your medical insurance. So that's the part that you don't wanna take until you're ready to retire, or if you wanna go ahead and just take Medicare instead of your employer.
So, who qualifies for Medicare? Is it an age limit? Like, what's the qualification process look like?
Yeah, so most people that are on Medicare are, aging into that 65 and over. So you can get on Medicare. Well, yeah, you'll get your Medicare number usually 3 months before you turn 65 if you sign up for it. Um, so it's mostly 65 and up, but there are people that are under 65 disabled that can also get Medicare. So it's usually by the 25th month of your disability that you'll get auto enrolled into Medicare.
I see. That makes sense. Okay. Well, do you have anything? I mean, I know it's open enrollment period, so you're probably swamped right now. But do you have anything else coming up in the future? Keeping in mind this would probably be posted like around February, March.
Okay. Yeah, so February would be good because there's still an open enrollment period from January 1st to March 31st, which would allow people to make one change. If they're an Advantage plan, you can make one change to your Advantage plan during that time. So even if you feel like, oh my gosh, I didn't know, I didn't catch this episode during the enrollment period, you can still make one change to your Advantage plan in that time frame.
Well, this has been a lot of information so far. So let's kind of start from the beginning, if you don't mind. Where did you grow up?
Sure. So I'm originally from the Austin, Texas area. Grew up there, and moved from Austin to Southern California when I was about almost 21 years old. So,
Okay. What brought you to California?
dreams of becoming an actress. So,
No way.
uh, I wanted to move to LA or Hollywood rather and become an actress, and never did quite make it out of Palm Springs area.
So you went from wanting to be an actress to Medicare. How did that happen?
Oh, it took many years. So, and when I was living in Southern California in Palm Springs, it's a very resort type of area. There's lots of golf courses. And so, if you live there, you're pretty much either in the service industry or you're a golf pro. So, I am not a golf pro. I was in the service industry. So, I was a bartender for many years. And so that was, many years ago. But I was bartender for the first part of my life. And that's where I really learned how to talk to people and relate to people, and that kind of, I guess, honed my skills for, like, what I did later, in my adult life. Yeah. Does that answer that part? I think.
I love that. So, it's funny. I feel like bartenders are therapists, sort of in large part. I did a little bit of bartending in my younger years, and I feel the same way. Right? You get somebody that bellies up to the bar, and they look a little down, and I feel like just human nature. You automatically want to cheer somebody up. What's going on? What's happening? So yeah, I can definitely see that helping build that muscle.
Mhm.
Yeah. So what brought you to Pennsylvania?
So I was in Palm Springs at the time and just like I'd gone through kind of a messy breakup with someone and I was just like I just felt at the time I wasn't meeting any quality people there. I was kind of done with living in California. So I met my current fiance and we we met through like an online like a cell phone game really honestly and we just became friends and we just started chatting and I decided I would come out and meet him and I guess the rest is history. I didn't move right away but I met him and I decided you know what, this is a beautiful area. I love the four seasons. It's so different than anything I've ever experienced in Texas or in California. So I was like, let's do this. So I rented a room from a lady and we tested the waters a little bit and then decided that, yeah, I think I'm gonna move and make the change. So I did. Moved in and I was like, "Oh, my first time." That winter was my first time ever experiencing with like I think we even got a blizzard that first year I was here. I was like, "Where did I move?"
That could be a shock, for somebody that's never experienced well, you don't get snow down in Texas, do you?
I think, the last time we got snow, I was like a small child. It was like and it was like Cody. The whole state shuts down if we get ice, snow, anything. We're not equipped to deal with that, so
Yeah. I know a couple years ago, they got a really bad ice storm, and that made national news.
semis, people were crashing into semis and everything. It was nuts, and that's so I just like to if it's snowing or icy out, I'm like, "You know what? If my son doesn't have to go to school, I'll just stay home that day." So,
Good for you. Oh, so brave of you to move halfway across the country. But yeah, I can definitely see the four seasons being appealing.
beautiful, very beautiful. Mhm.
Oh, it's so funny. So I heard you say your son, how old is he now?
He is 7. He is 7. He's in 2nd grade. He attends St. Teresa of Calcutta here in, Hanover.
Yep. I love that. So, when you came, have you been in so for those listening, Snacktown is what I like to dub Hanover as, Snacktown, USA. So, has he always been in the Hanover area?
Well, we actually live right across the border, of, PA Maryland, PA, so we live in Hampstead. So he's actually yeah, that's where we actually live, but I've since he was born, I've brought him up here because, my office is either this office or my other office where I was renting a space from someone else, has always been in Hanover. I've always worked in Hanover, so, he's gone to pre-K and up here, so it's a little bit of both. We've got the Maryland and the Pennsylvania, in our blood.
Yeah, Hampstead's such a beautiful area too. So, does he do any, sports or instruments? What's he into?
Yeah, he does. He's very musical. Our whole family loves music. He is actually in the choir at school. He's in they let the 2nd graders just now join the choir. So got to go and see him perform, the whole 2nd grade choir perform at the mass. They have mass every Wednesday there. So it was so cute. I got pictures. I'm the only one taking pictures in this Catholic church of the kids up there in the balcony singing and everything else is very, serious, and I was like, I gotta get pictures of him up there doing this." So he does, yeah, he sings, he, is finishing up fall ball right now. Saturday is his, championship game. Now he plays with Hanover Diamond Sports, yeah, and then we're about to start basketball in, about a month or so.
That's exciting.
Yeah, and then Cub Scouts. We gotta stay busy, so,
He's gonna be well-rounded, that's for sure.
yep. One biological, so I'm like, "You know what? We're gonna do this." And he loves doing it. He loves doing all the stuff, so
That's awesome, good for him. So, I heard you say earlier too that you like gaming. Do you have any platforms that you favor?
Not really. We don't like play like console games, I mean, when I was a kid, I loved, Nintendo and that sort of thing, but mainly it's cell phone gaming, just in my time I like to play my cell phone games.
That's awesome. Very cool. So, if somebody wanted to get in touch with you to talk about open enrollment and setting up a plan, how would they reach you?
So I can be reached at my phone number, which is 717-524-0300. And I also have a website, which is the medicaretutor.com. And then my email, which is Emily at the medicaretutor.com.
Awesome. And your office is in the Eichelberger building?
Yeah, we just moved here. The March 1st was our first month here, and so yeah, the third floor of the Eichelberger building. So right here, pretty local.
I love that. And that building is so like one-stop shop, right? You've got a dentist in there. You've got what other businesses do you have in there?
Oh my gosh, the dentist is right next door. Then there's a CPA and an accounting firm right across the hallway. There's a cardiologist. There's a primary care, foot doctor, and that's just on my floor. There's even a cancer doctor place here. And then second floor is mostly like I think just offices, like medical offices. But then the first floor has a chiropractor, a hairdresser. She also does nails. Um, and then there's like a yoga place and like a acupuncturist and yeah, all the things.
All of your needs met under one roof.
Basically, yeah, I love it. I just go across the hall for my primary care doctor. Perfect.
Oh, so convenient.
Yeah, I love it.
Nice. That's awesome. All right. Well, so we did promise folks if they stuck around to the end, we would tell them about a drug deductible that they may not know about. So, could you give us a little bit more information on that?
Yes, yes. So, when this episode airs, it's going to be the new year, and you might have been shocked when you went to the pharmacy to notice that, oh my goodness, last year I didn't have this big chunk of money due, but now I do. Most of these plans have now moved to a model where they charge a deductible at the beginning of the year. So if you are on a more expensive medication, a lot of people are on Eliquis. A lot of these GLP-1s are oftentimes well, not covered if they're covered for diabetics. But yeah, so if you fill any of those in January, you might be shocked to have to pay a huge deductible. So on most plans, it's around $615. So one thing to remember is that's not a monthly charge, that's your deductible and your copay for your medication. But if that was never, if you weren't aware of that or, nobody ever told you about that, then it's important to review that.
That would be a big shock if you weren't expecting it.
Right. Exactly.
Well, thank you so much, Emily. I'm sure our listeners are going to get a lot out of this. I really appreciate you being on here. So that wraps up another episode of Bodacious Estate Conversations. Thanks for listening, and we'll be back with more great stories and tips soon. Bye.
Pleasure. Bye.
Bodacious Estate Conversations isn't just chatter, it's about learning, taking action, and finding solutions that actually work. If today's episode resonated, share your thoughts, subscribe, leave a review, and pass it along to someone who could use a hand. More stories, smart strategies, and practical guidance are coming in the next episode. Don't miss it.